through your years in medical school and then afterwards. The reality is that AI can learn that incredibly comprehensively today and remember more than a human mind can. So access to that knowledge, not the interpretation, but that raw knowledge is something AI can help with. It's a medical skill, clinical skill they can do. Then they hope that before they come through the room, you have read their medical records and are familiar with their history. Now, you and I both know vast majority of doctors don't have time to at least do that in full. Then they want to talk to you and ask questions. We are in India, in an average third city in India, the length of consultation, I believe, is only 2.5 minutes. So no real consultation can happen in that period. It's not because these doctors are bad, it's because there's an imbalance between. But AI can talk to you for hours, if you wish, and ask all questions. And you can go down the line. I don't want to take this too long. But if you unpack it to 10 basic steps, then you create hypotheses of I could be wrong. 5th, you will ask them to do some investigation. 6th, you will refer them to the right specialty. 7, you diagnose, then you prognose. And what you see is almost in every one of these steps, AI, there is clinical skills that AI can do very well, which in a way creates an unlimited supply of those skills because AI can be massively scaled, but in a way, none of those things AI can do that well.
That's right, yes.
That well, and that's where somebody like you should come. So this hype that is AI going to replace a human being, I just think maybe one day, who knows? But at this stage, it's great for journalists and great for futurists to make a living out of. I think in real life, it's more complex.
I think, Rajendra, when you have this conference next year, there will be examples in the marketplace, and maybe there already are, I don't know, but of AI agents with no human in the loop. Right now, that's the other theme that I hear is human in the loop, which I'm a big proponent of because, as I said, if there's a hallucination in the beginning of that agentic flow and it screws up my patient's outcome. And by the way, if I'm not smart enough to look, double check everything in the US, I'm liable for that. That's another angle to it. But I think it's happening, and I'm not sure I think it might be that the cat's out of the bag or the horse is out of the barn, but I worry a little bit that we're ahead of ourselves. My next question is about radiology, and I'm sorry, I don't know your name, sir, the radiology. In the mid-90s, the big controversy at that time in the US was that radiologists had a rather good lifestyle and they were rather well compensated. And they sort of said, I kind of like my lifestyle. I don't really want to read films between, 5 p.m. and 7 a.m. in the morning. I'd rather go home to my family. And so we started hiring people for much less money in places like New Zealand or India or the Philippines, and radiology reimbursements went down as a result. So in my opinion, they kind of cooked their own goose because they were too comfortable. Is that same sort of thing going to happen with AI? Now, I have to say, Rajendra, I would have predicted you would have said radiology because it's all image focused, images are data, and I think sooner or later, I'm not a radiologist, but I think sooner or later, the computer's going to do a pretty good job of making those diagnoses. So, question for you, and again, I'm sorry I don't remember your name, but is radiology at risk for being displaced in one of Rajendra's 5 areas, and what do we do about it?
Radiologists would be replaced by AI?
By AI, yes.
Yeah. I think the fear is unfounded for the simple reason that AI is going to teach me a lot of radiology eventually. And AI is going to predict what the disease is likely to be. And we are not just going to be diagnostic physicians henceforth, but we are going to be interventionists, as I said. And the future radiologist is going to have hand skills that is how to puncture an artery, how to puncture a hollow organ, but they are also going to be integrators of data of all other specialities. So at one place he is going to integrate the data and come to a diagnosis with the help of AI. One who adopts AI will survive, one who doesn't adopt AI is going to perish.
Yeah, thank you for that. And again, these are deliberately to point out just that we're at an inflection point with this stuff, and it'll be interesting because, as was said multiple times this morning, it's moving pretty fast. I have one more question, and then I'm going to open it up, so people get ready, and we'll take your questions here. But my question is for you, Christian. We use UpToDate, and sometimes I find it a little hard to access, whereas Google is right there, Gemini is right there. And I think you spoke to this somewhat, but how do you position UpToDate so that it doesn't get commoditized by other agents that are out there and just easier to access?
Yeah, very good question. This is what I was calling UpToDate AI. So next week, bit of a spoiler, we will communicate in the US availability in a limited number of hospital system in the US, and it's more of a ChatGPT type of experience, right? So it will be totally generative AI, grounded into the current content, so reducing the hallucination risk. But it's necessary because we do